Hi, I'm Lisa Gualteri, and I'm the course director for Mobile Health Design.
And I'm Meghan Hamrock, and I took the course last summer.
So I wanted to talk to Meghan about what she did for her excellent final project. What was your topic and why did you pick it?
So I chose to do my paper on medical adherence in an app version for patients. And I was very interested in doing this as because we know the prescription drug companies are spending lots of money and lots of money is generated into this industry, yet 75% of patients in some fashion are not adherent to their medication. So it's very interesting to see the behavioral issues surrounding this.
And how did you see mobile health or your app design as helping with this huge problem?
So as we know, mobile health is growing, and it's really important to really play into the patient's mindset. So knowing what they're interested in, why they need these things, and how we can be a part of their daily life in order to help their medical adherence was key. So really looking at what the patient's understanding of their medication was and how they wanted to be reminded and what the information they were seeking, and being able to apply that into an app form.
So it sounds like your design was really starting with who needs this kind of help, and
Exactly.
Did you do a needs assessment first?
I did. I did some formative research to see kind of where everything was laid out and how we could really tweak that and see what was changed. And I did some competitive analysis as well with different apps that were currently on the market and what I was kind of getting from that with what the patients were seeking, more or less. So it was really interesting to see that patients wanted this information. It just wasn't necessarily available through the competitive analysis. So either the app cost $20, and it was only available for an iPhone, and it only had 3 of the functionalities that would be important. So finding that happy medium in one app would be sufficient.
What were the key features of your design?
So the key features of my design were really playing off of a questionnaire-based role and seeing where the patient was. So a lot of times the personas that I created are busy. They're having 2 or more family members that need to have medical reminders, so making sure that it was applicable and accessible for all these family members, not just one, and then making sure that we were tying into their exact needs. So do they want a pill reminder? Do they want it 10 minutes before, 5 minutes before, the day before? How did they want to receive this information? And making sure it was color-coded accordingly and making sure that it was very easy to follow.
It sounds like this would be incredibly useful if, I know you haven't actually developed this app,
Exactly.
but if a venture capitalist was to give you a couple $100,000, do you think that there's a need for this?
I definitely do. I think the functionality of this would be huge. I think patients would really like to see something like this that they could use and that they could afford, and that would really help their medical adherence. They're spending the money as is, so why not get the most benefit out of it? So if it could be created into an actual app that patients could utilize, I think it would make a very big difference in those numbers.
Do you see this as something that physicians or hospitals or insurers could be recommending or suggesting to patients?
Exactly. So part of the marketing plan was really tying into who could be the sponsors of this, and it's got to be credible so that the patients do understand and do know that this information is useful. So hopefully that the doctors could recommend it, or the hospitals, as you mentioned.
Right.
Yes.
Well, great.
Yes.
It's a really exciting project,
It
and
is.
I hope you actually go and develop this.
This would be great. It would be great to see it actually used.
Thanks so much.
Thank you.